we're doing our testing and we have some type of vertical probing depth. Maybe you don't. Maybe you've got the J-shaped lesion. Maybe you don't. Maybe you just have this lateral bone loss. Maybe you don't. But the second that tooth is vital, right? You put cold on it and they're like, oh, that takes away the theory that a necrotic infection is creeping out of these portals of exit, causing the bone loss. So if you have a necrotic tooth and you have the possibility of drainage, then you really have to take vertical root fracture as your second choice. The first choice is that there's infection draining out of the tooth. And that infection could definitely, from an imaging standpoint, create the identical look of a vertical root fracture. But if the pulp is vital, now you do not have any type of evidence that you have an infection that's draining. And now your primary suspicion is vertical root fracture. So what I'm saying is the pulpal diagnosis will drive a lot of your thought process on, is this tooth savable or not? Because if it's necrotic, you have to account for the fact that drainage could mimic a root fracture. It could mimic a pattern of bone loss that would look consistent with a root fracture. But if the tooth is vital, that cannot be part of our speculation.